Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we're going to have an important discussion about the preparation of inmates when they get out of prison, what's going to happen with them with financial education and jobs. It's important. We have the Secretary of Corrections, John Wetzel, and Pat Conway from the Pennsylvania Credit Union Association. But first, we're going to continue our conversation about the serious opioid addiction problem and its effect on all of us, and we'll do all of this after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, we have an extremely important show today, so stay with us. We're going to get into a couple of very, very important aspects in our society that need a lot of attention. Joining me to talk about the opioid addiction, I'm going to call it an epidemic. I'm going to ask him if he agrees with that, is Richard Edley. He's the president and CEO of the Rehabilitation and Community Providers Association. I think I got that out, didn't I?
That's correct, RCPA.
Right. Am I right? I mean, this is a problem. The opioid addiction problem is an epidemic of such, you almost can't calculate it anymore in terms of its effect on the folks, can you?
It really is an epidemic, and I could throw out numbers, but it doesn't even do it justice. In Pennsylvania last year alone, over 4,600 people died from overdoses, and that's double the national average in Pennsylvania, and it's up to about 13 people a day, and it's going up 30-40% each year. And it really is something that in Pennsylvania we need to start taking a very close look at. Yeah. We talk about all sorts of other diseases, and right here, this is something that's affecting our loved ones, our neighbors, our families.
And sometimes it starts out with great intentions, right? You get a drug, to cure an illness that you have, and most of the time to do what? Prevent the PAIN word, right? To prevent pain, which
right.
is... And it goes awry because it continues to grow. And well, all right, well, let's talk about this. There are what impresses me is, given this extreme partisanship, it's one thing that Democrats and Republicans do agree on. You're shaking your head. Am I right about
Yeah,
that?
it really is. And this is a time that you're right about partisanship. They can't agree to anything. But this is something that's impacting every family. And you made an excellent point. Sometimes people think, oh, what is this about, heroin? Well, yes, it's about heroin, but it's also about painkillers. Yeah. It's fentanyl and
Often
others.
It starts there.
And even sports injuries with adolescents and so forth, and elderly. And so it really does impact everyone. So when I've gone to the legislature, you're right. This is something everyone can agree on. We need to figure out a way to prevent this, to help this, and so forth.
Okay, so assuming you would have the resources to do that, and there have been some resources proposed and adopted by the state of Pennsylvania, the federal government also is getting involved in this. What would you say would be the first initial steps that we should take to combat this? Well,
before we even get into the treatment side of it, education's important. Yep. And I know that's easily said, but really educating physicians, even at the point in universities about prescription practices and so forth, educating consumers on use and storage and abuse, things like that are so important. And then there's also something that is available called Narcan, which is available to first responders, and actually the Physician General, Dr. Levine, made it available for all first responders to use if a person is in the process of an overdose, and it saves lives.
Yeah. That's been demonstrated. I've
absolutely
read about this, and I'm sufficiently aware of it to say this is an important use. Go ahead.
Yeah, no, absolutely. It really has taken hundreds and thousands of people and brought them back and into treatment. Then when we talk about treatment, there are evidence-based practices, specifically medication-assisted treatment is available. Things like Suboxone and buprenorphine, along with counseling, really does help. So if we can engage a person into treatment, and there's also in Pennsylvania something called a warm handoff, taking a person from an emergency room and making sure they're connected with treatment, rather than just having someone who's an abuser or someone who's addicted and say, here's a name you can call. Yeah. They're not going to follow.
What strikes me is that it's often unrecognized in families where you take these prescriptions in some cases, and at first they're very helpful, and then it gets to a point where they're not as helpful, and then you go out and move to other drugs, stronger drugs, and then ultimately, as you know, you're the expert on this, to illegal drugs such as heroin, cocaine, and others.
When the prescriptions run out, you have to do something. And I remember the last time we spoke, I had mentioned something in passing. I had a personal experience. I had some stitches a year ago, and I got a major prescription for an opioid. And I thought, I don't need it, so I just tossed it.
Yeah.
I had to go back, and they gave me another prescription. And I'm thinking, how many prescriptions do I need for something? And I've been turning this down. And that's what happens day in and day out. And people don't realize
I'm drug intolerant to most drugs, so I can't take them anyway. And I've had 2 knees replaced, so I've been through that. But that's a great point. All right. So let's talk about where folks should turn for help. You've identified a problem. Where do they go? What should they do?
Several options. The first is Pennsylvania, and under Governor Wolf, I will give him credit, has really taken this on and understood the seriousness of this issue. There's a hotline, 1-800-662-HELP, that person, family member can call and get connected into services. There's other options as well. Every county in Pennsylvania has something called a single county authority, an SCA, which is available to help with referrals and getting people linked up to treatment. The administration has also funded 45 what they're calling centers of excellence, which are in place across the Commonwealth, which again can help link people to treatment, do case management, and so forth. So there's several options.
All right, we're going to run to a break. We're going to continue this discussion. We're going to talk about the amount of depth and diversity in these programs and service care. This is important, and we'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back. Opioid addiction. It is now a major crisis, not just in Pennsylvania, but all over the country. And one of the things we can talk about, they're going to put an 800 number up where people can call to help, to get some help during the course of this discussion. But the human services sector is a very substantial field in this state, and it has depth and diversity. What's the challenges that they have in getting assistance to people?
Well, it's interesting. We just talked about drug and alcohol services. Our association represents a very diverse group: mental health, drug and alcohol, intellectual and developmental disabilities, brain injury. I can go on, and they all have individual issues. But the one unifying issue are the low wages that direct support professionals are getting. And it's ironic that the people who we turn to care for our children, the elderly, the disabled, physically and emotionally disabled, we pay the lowest wages, below a living wage. And it's getting to the point where it really is a crisis that we see at agencies.
So the people who are supposed to provide help to people, you've got turnover and a situation with that isn't good, low paid, few benefits, I presume.
Yeah, we just, along with several other associations in the state, commissioned an independent study. The average wage is about $11.50 an hour, and it can go down below that. And that is not enough to even support yourself, let alone a family in this state. So what you end up is losing staff. These are people who really care about what they do, but if you can get paid more going to Walmart or to a call center and get benefits. So there's high vacancy rates, turnover, and so forth. And these are people we need to care for the disabled and children and so forth.
So you're pushing, I think in a press release that you had a $15 an hour. Take it from there. From this study, we just released, had a press release earlier this week, and in the study, it said that really we should get it to as high as $18 or more an hour, but at least start with 15 as an initial step. And one thing is, people would say, well, why don't you just go to these agencies and tell them to raise wages? I mean, just do it.
the issue is that most, if not all, of these agencies are entirely publicly funded.
Yeah, great point.
They don't have they're not like McDonald's. You raise a Coke a penny and raise wages.
Right.
They're not able. And the other thing is that, so then taxpayers will say, well, you raise wages, it's going to be more taxes for me. But these individuals are being paid so little that they're on a lot of public benefits, Medicaid, CHIP, child benefits and so forth, LIHEAP. So they're accessing public benefits that taxpayers are paying.
Good point. Well, look, I want to thank you for coming in. This was an important update. You'll keep us updated. You'll come back on when things change. We're not going to let this subject alone. All right, incarceration in the state prisons is just more about holding people in retention. It's also about preparing them for when they get out of prison to take up a decent life in society. We're going to talk about a couple of people that know an awful lot about that, and we'll do that after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
All right, we're talking about an important subject. We often get into incarceration of prisoners and the treatment of prisoners in Pennsylvania and national correctional institutions, but there's also the question of the transition from being locked up in security into the workforce, into society. And boy, do we have an important program to talk about. Joining me is John Wetzel. He's the Pennsylvania Secretary of Corrections. Welcome, Mr. Secretary.
Thanks for having me.
You've been on the program before, and you're always welcome here. And Patrick Conway, he's the President and CEO of the Pennsylvania Credit Union Association. Now, Pat, we've talked about your programs in schools all the time, right? You come in, how you take your financial literacy programs into the schools. This is a different kind of venture for you, right?
It is, Terry.
And exciting.
Credit unions really enjoy financial literacy efforts, and they've been in the school districts for years. We're in about half the school districts around the Commonwealth. But for the first time, we have partnered with several state agencies, including the Department of Corrections. Pleased to have the Secretary with us this morning. To really focus on, folks that are coming out of, state prisons that are going to, need to be coming out, and, we can help them, learn about financial planning, to give them the skills that they're going to need to re-enter society productively. And it was a
great point.
It was a great project, and we're looking forward to doing more of it.
Before we talk about the specifics of that has to be one of the most incredible challenges that you all face, because they're incarcerated sometimes for 15, 20 years, and they have to go back into society, and we all expect them to be perfect in this transition, and they often don't get any kind of assistance to do that.
Yeah, I mean, we release 20,000 people a year.
Oh my God.
There's not one county in Pennsylvania that we don't have somebody going back to. And so one of the approaches we've taken is let's look at things that are going to stand in the way of people being successful. I wouldn't have guessed that financial literacy would be something that wouldn't have been the top of our list. But I got to tell you, one of the things that Governor Wolf has really charged our administration with is looking across agencies, and let's wrap services around what the needs of the individuals are. And so we partnered with the banking, I guess it's Department of Banking and Securities, and they suggested this, and we were fortunate enough to partner. When someone gets out, there's a lot of challenges to being successful.
Oh my gosh.
One of the things you're gonna have to be able to do is, if you make money, we try to get them jobs, is be able to manage that money. And so we're so fortunate to have the experts, instead of trying to build expertise in our staff who are experts in corrections, but certainly not financial literacy.
Sure. So how is this working? Is this you have a grant from the federal government? Is that correct? How did the money for this program?
I think our program was all volunteer.
Oh, it's all volunteers.
Yep, our Credit Union Association staff, Department of Corrections, Banking and Securities, the other state agencies.
You're the people who got the grant, but go ahead.
Yes, and credit union volunteers from around the state. We did 5 simultaneous reality fairs at the same time in different areas throughout the state, and it was a great success. I was at the one in Harrisburg, and I think we had 60 or 70 people come through. And these are inmates that are coming out and reentering society that are interested in helping themselves. So they came to the program and they met with the volunteers, and they really, I think, took away skills that will hopefully help them be successful.
And go ahead.
I'll tell you, the thing that blows me away is, first of all, for an organization to have 200 volunteers on a Saturday, which is a big deal during football season, no less, which is an even bigger deal for folks like me.
Yeah.
To come, there was 548 re-entrants, people coming back to the community who benefited from that volunteering. I mean, when you hear of a credit union and the connection to the community, it really just it does my heart good to see your members just volunteering to make a difference, because we're invested in people coming out of prison and not committing more crimes.
Yeah.
And efforts like this really get us closer to that.
Yeah. I mean, from my point of view, that's not important. But anything that participates in orienting, former inmates into society, if it gets them connected to something, and it probably gets them connected to these folks, people volunteers that they can call for assistance, and it's all about building these networks, isn't it?
It is, and I think the relationships developed, and I can say, I think our volunteers got as much out of it as those participants that are coming out of state prison, re-entering society, because I think it's good for everybody involved, rolling up their sleeves, working together to help folks, re-enter and have a productive future. So it was really exciting.
Yeah. Now, you got some money from the federal government, right, to do this? What's that about?
Yeah, we got a $1 million grant, actually, over 3 years. It's called a Career Pathways Grant. And it's recognition that we're going to release 20,000 people, and they're going to have an impact on the community, either a positive impact or a negative impact.
Gee.
And so this Career Pathways, you can conceptualize it like this. When someone comes to prison, 95% of everybody comes in our front door is going to leave our back door, okay?
I got that.
So
it took me a while to process that, but I got that. Go ahead.
From the time they come in, it's in our best interest to try to put them on a path where they can be successful.
Yeah.
Having a career trajectory is important. So we really want to take the approach like a kid going to a community college, an undeclared major going to a community college.
Yeah.
I know I want to do something. I don't know what the heck I want to do.
Yeah.
So this grant allows us to align their aptitude or what they have the ability to do with their interest. And one of the things that we've really learned is that we're not experts in everything. We are certainly are not financial literacy experts. Yeah. But when we can find partnerships like this to provide individuals with the skills, and to your point, connections with positive, successful people in the community, that goes well beyond.
And there's also, we're going to run to a break, but I want to talk about something that's called Parole and PA Career Link. I mean, it's connections and building these relationships that really matter. We'll take this up and more after these words.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives.
Let's do that. Welcome back. We're talking about a number of aspects of prison reform with the head of he's actually the Pennsylvania Secretary of Corrections, John Wetzel, and Pat Conway with the Pennsylvania Credit Association. He heads that organization. All right, you were talking about career links, and why does that matter? Why is that important?
Well, when someone gets out of prison, during the time they're incarcerated, the reality is they're a tax burden. And our goal is to flip that equation and have them be taxpayers and have them be productive citizens. We know employment is a key piece of that, and then being able to keep the money that you make is a key piece of that. So we've partnered with our partners at Labor and Industry And 2 years ago, I believe, the state was required to do a new workforce plan. It's called WIOA.
Yeah.
And we were really fortunate in that, again, the governor takes a broad view on government and says, let's get together. So we've worked with our partners at Labor and Industry. So one of the key things is how to have an individual help find a job. And we have this infrastructure across the state of career links that do a very good job of connecting people who are looking for employment with employment. Right. So again, building off an existing infrastructure, plug our 20,000 people into this existing system and not have to retrain our staff or get an expertise in an area we don't have.
Where does all this go? Where does all this go from your point of view?
Well, I think, our first effort was very successful, the 5 regional events that we held. So I think we would expect to do more of
You're
this.
You're going to expand it?
It was, absolutely. We'd like to grow it. It was a great feeling, I think, for the volunteers that came together with the staff from the departments to help folks. And, we look forward to doing more.
Before I let you get out of here, I got to ask you about Lehigh University engineering and this app that saved you a couple of $1 million. Tell the folks.
Yeah, it's really cool. So we 5 years ago, we started this, and we move about 900 inmates a week on buses all over the state.
All right, they get sentenced and they have to be. You have to decide where they're going to go.
Which of the 25 prisons they go to.
Right.
And it wasn't a very efficient system. So I tasked our staff with trying to figure out how we can do it better. And if you think about moving inmates around, it's a lot more like UPS than it is corrections.
Yeah.
And my head of research, Dr. Buckland, said, this is industrial engineering. This is an industrial engineering problem.
Yeah.
Let's approach Lehigh.
Right.
So we partnered with Lehigh. We used a bunch of their whiz kids, PhD students, and some of their professors for a very relatively small investment. I think it was about $150,000 or $200,000. They built us a system based on an algorithmic-based system that just won an international award that is going to save Pennsylvania taxpayers $3 million a year.
For $150,000 or something.
So, absolutely, for $150,000 investment, one-time investment.
Yeah, but there's another aspect of this that's in the reporting, which you all have made. Number one, you have to decide which one of 25 prisons works for a particular inmate. You have to figure out based on their health, based on their education.
And programming needs.
See, so this helps you do that instead of having to go through all those interviews and figuring it out by, go ahead, finish.
Yeah, so we
used
to use literally paper and pencil.
Oh my God.
This app now does what used to take weeks by 7 people, seconds. Just like, we're a technology world now. Really amazing, and I think it's a really good illustration of another unique partnership like our partnership with the credit union.
All right, 50 seconds left. It's International Credit Union Month, right?
It is. October's International Credit Union Month. It's basically an international celebration of the great work that credit unions do in their communities.
Okay.
Like we talked about this morning, this type of effort.
All right, we have you back frequently. I'm going to get you back. You're going to come on. We're going to talk about a whole bunch of other aspects of prisons and prison reform. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.